Hello, bonjour. Welcome to the Union Safety Net, le filet de sécurité syndicale, a union podcast for working people. I'm your host, Sébastien Bezeau, et oui, parfois en français aussi. This podcast is hosted by the Union of Safety and Justice Employees, le syndicat des employés de la sécurité et de la justice. Join us for an informative discussion every month about issues currently affecting working people. So with me right now is Kirsty Havard. Kirsty, you're a member of the Union of Safety and Justice Employee, and you also protect Canadians every day. So tell us about your role in public safety.
So I'm currently the Regional Vice President in British Columbia, representing members that work for the Correctional Service of Canada, working in institutions in British Columbia. So I basically am a union rep, and I represent members and support my locals. So that's a little bit about my union role.
Now, before you got involved into the union, what did you do in terms of working for Correctional Service of Canada?
I did various different roles. I started off as a CR3, actually, in administration in the switchboard and mail. And then I became a Correctional Officer 1, a Correctional Officer 2, and then I did Parole Officer and Programs Officer.
Now, what would lead someone to work in this field other than wanting to protect, your community, your family? Like, what was your drive? What made you go into that field?
I went to Simon Fraser University, and I was taking different courses, and the criminology ones, I started taking them, and then I found them really interesting. So I did that, and one day there was a job fair that came, and I attended, and they said, well, if you take our training course, we pay you while you're taking the training. And I started to volunteer as well, taking inmates out on passes. Progressively, then I just applied for a job and got in that way. So
I understand that working for the Correctional Service of Canada is not an easy job, even though you might be passionate, you might like, what you were studying, criminology and whatnot. And unfortunately, in your case and for many of your coworkers, you incurred an occupational stress injury while working on the front line. Is that the case?
Yes.
So without going into too many painful details, I don't want you to relive the experience, and I'm sure people listening can relate to your story based on their own experiences. Can you tell us what contributed to the injury and how it became apparent that your mental health had taken a severe hit?
Yeah, so it started actually was being exposed to many different incidences over several years. So it's cumulative stressors and things that happen in the institution. So seeing inmates assaulting staff, inmates assaulting each other, self-harming behaviors by the inmates, and then also reading graphic materials on a daily basis, reading inmate files and things like that. So doing that day in and day out, for many years does take a toll eventually. But I was exposed to a few different things. So one was quite early on. I was an acting institutional parole officer, and they were asking for people to volunteer to take inmates out on passes. One of the inmates was asking me to take him on a pass. So my coworker ended up taking the inmate on a pass, and he was taken hostage at knife point on the way back. So it really shook my sense of safety. And luckily he wasn't physically harmed, but it does have an impact, right? So from there, I decided I'll try being a programs officer, try something a little different. So I went into that field, did that for several years, a couple different programs back in the day. One of them was a violence prevention program. And that one is a 6-month high-intensity program with inmates that commit Schedule I offenses. So 2 serious offenses with serious harm, like a minimum was the criteria. And I enjoyed the program. I got to co-facilitate with a psychologist. So we got to, I got to see more into human behavior and why people behave the way they do. And that's what interested me, and I found it fascinating. And one particular program, I think it was my second or third one, an inmate handed in his homework to me, and there was a note addressed to me about how he was going to, cut me up and harm me. So that had an impact. I didn't take any time off work. I finished the program for another couple months, but I said, that's my last program. I need to have a change. I was not feeling right. So I then went back to being a parole officer because I felt like that was something where I would have more control over my settings and things like that. And then I had a really busy caseload. Once again, lots of graphic material, which our members know exactly what I'm talking about, but just dealing with that and the pressures. And then it was 2008, Mountain Institution had a riot, and they gave us all these briefings about hostage takings and stuff and what to do, what not to do, which I've heard before. But I think because of the buildup of what had happened several times over the years, they talked about, don't let them put a bag over your head. And then we talked about there was no real safe escape routes for us working in the institution. My office was in the living unit. And then you start, thinking, and it just kind of went down from there. My health deteriorated.
You've listed a lot of, for me, traumatic events that I don't think I would even be capable of sitting here to talk about it, openly today. So thank you, first of all, for sharing that with us. But you're painting a picture of a job that requires the staff to go through various series of traumatic events just in one workday, right? So, you need some sort of support to deal with that. So speaking of which, did you have access to the proper support once it became clear that you were suffering from an occupational stress injury?
No, I did seek the employee assistance program at the time. They didn't have trauma-informed counselors, so I think I was traumatizing my counselor, telling them, the things I was exposed to in the workplace and what was happening. Yeah, I didn't have the proper supports. I did use that's when I started to learn, I think, 8 or 9 years into my career, starting to use my benefits. I started, I went to my doctor. I wasn't well. He said I should go and get some counseling. So I found a psychologist through our extended benefits. And then I started from there on my own.
Well, so basically there really is not an established support for personnel on a day-to-day basis. Because even myself, I couldn't do that job. But if I were to do it, I would need to rely on some sort of crutch regularly at the end of my shift just to make sure that when you go home, you don't terrorize your family you can't talk about what you've gone through. So it's really hard to deal with. So from your perspective, of all the lessons learned during these situations, we should say, what would you advise others to do if they find themselves in a similar situation?
If you notice you're not feeling well and something's off, go talk to your doctor, go talk to a psychologist. Luckily, we have extended benefits. So pay and find a psychologist, especially one that knows your area. So if you're at RCMP or corrections, they understand kind of the work environment and that they are out there. And find those supports and start, documenting, right? If you're noticing something's off, don't be ashamed to go for a mental health checkup. We all go for physical checkups. Everyone thinks that's fine, but no one thinks about going to see a counselor or a psychologist to make sure your mental well-being is okay. So I still see a psychologist to this day, just to do check-ins and when I'm not doing as well, because there's other things that come up in our lives or stressors that we all need to take care of ourselves. So, and also know that there's for workers' compensation, start filing reports. You don't necessarily have to move forward with it, but if something traumatic does happen, make sure you document it, because that's really important in at this point in time, getting those supports in place and ready if you do need them down the road.
So I know, Kirsty, that, with your past experience and unfortunately the trauma you've suffered in the workplace, it's what made you an advocate. That's why you joined your union. You played an active role in your union. You're now in an official elected position for your union. And with your advocacy and with working with your unions and colleagues, we've seen a private member's bill, Bill C-357. And I know you played a key role in that bill. So can you talk to us a bit more about that bill?
Yeah, definitely. So it was actually at our convention. We decided to invite it happened to be my MP, Member of Parliament, Peter Julian, and our president, David Neufeld, encouraged us to invite him. And he came and saw what we had to say. And it was actually just after his presentation that he spoke with us right afterwards. And we had discussions about what we needed. And he offered to helped us draft legislation change for the Government Employees Compensation Act to be changed on how, workers' compensation is administered to federal public safety employees.
Now, I believe the Government Employee Compensation Act hasn't been reviewed in over 50 years. And if we go back 50 years, mental health is not as prominently discussed as it is in today's day and age. So with this modernization that you want to bring to the Government Employee Compensation Act, if it were to be adopted, what would be the result of that bill? What would change for you if you were to be in the workplace back tomorrow?
Well, you wouldn't have to wait for your claim to be approved, right? So for me, my claim was initially denied and I had to wait months and months and months and then appeal it. This way, if I were to suffer an operational stress injury, I could get the help right away and get the counseling and get the supports needed, not having to wait for something to be approved. And that's what would change. And we do know that the sooner people get help, they're able to come back into the workplace and live happier, healthier lives. Not always, right? Sometimes people can't come back, but it's better to have those interventions early and those supports.
In terms of Bill C-357, if it does get adopted, there would be some clear supports provided to the members of your union who works in public safety and who keep Canadians safe. But in the long run, the employer, and in this case, the government, it would be a cost-saving measure as well, right?
Yes, most definitely. So if we're able to get people the supports early and get interventions there right away, people will be able to return, hopefully, to the workplace. More often than not, the longer they leave it, the longer they're off work, the less likely they are to return to the workplace. So if they are able to return to the workplace earlier, that would divert them from being on long-term disability, right, and not coming back. And it would also allow us to keep the public safety personnel employed, to keep that corporate knowledge within the organization and to keep Canadians safe. Something
you said did strike me. So I've heard the trauma you've mentioned that you've encountered on a daily basis in the workplace, and you said that your claim was denied at workers' compensation. I mean, I'm not a workers' compensation person that would approve, but I mean, just hearing what you said, how can they deny and how does that make you feel? Because then you have a whole appeal process that you have to fight again, and they re-traumatize you through the process, don't they?
Oh, definitely. Yeah. When you're not well and navigating the paperwork and the assessments, it's a lot. It's I could see why we do have members that just walk away or they don't even file a claim. Like they're just like, I don't want to put up with being denied and just going through all of that and having to tell what they're going through. People don't want to expose, what's happened and how they're feeling. It's personal stuff, right?
It's traumatizing again. Mm-hmm. Well, Kirsty, I do appreciate you taking the time to share your personal story with us. Congratulations on Bill C-357. I'm sure that brings you somewhat a little bit of comfort knowing that, we're walking in the right direction. And hopefully we will see the day where that will get adopted and that your coworkers will have the support needed. So once again, thank you for being with us today.
And thank you. And thank you to my union for allowing me to be able to do this. This is what I wanted to do. This is why I joined the union. And it's actually surreal that we have legislation right now. So get out and talk to your MPs and push the legislation.
C-357, everyone. So Dr. Ricciardelli, thank you for being here with me today.
Thank you for having me.
It's a pleasure to have you. Now, Rose, you are a doctor, but let's be clear, you're not a medical practitioner. You're not trying to heal physical ailments, but you have a lot of academia behind your belt. And we have to highlight everything you've accomplished and done for the workers of this country. So for our listeners to really appreciate everything you're going to have to say today, I just have to list your background. So Dr. Rose Ricciardelli is one of Canada's leading researchers in Canada on public safety personnel and occupational stress. She is a research chair in safety, security, and wellness at the Fisheries and Marine Institute at Memorial University in beautiful Newfoundland. You were also elected to the prestigious Royal Society of Canada, and you are also an inaugural member of the Academic, Research, and Clinician Network Advisory Council and a founding member of the Canadian Institute for Public Safety Research and Treatment, also known as CIPSRT. So, Rose, you are quite busy, aren't you?
A little bit.
So, Dr. Ricciardelli, Rose, you have undertaken research with USJE for a number of years now. Can you tell us how this collaboration started?
Actually, the collaboration, quite interesting. It was the former president, and Nancy as well, Nancy Peckford, who's still quite affiliated with USJE. We had talked a little bit about doing some work on different populations represented in the USJE membership. So we had started the conversation, started talking about it, looked at areas of need. And it was a really complex process that we later duplicated with the current president, David Newfield, where we were trying to figure out how to direct our attention for research, because you can't do everything at once, even if you want to, and where we needed to focus within the membership. And it wasn't necessarily the persons who required the most attention is where we selected to go. It was also what was more accessible. It was the size of that population. There was a lot of factors at play to try to make the most equitable decision as to where to focus our attention, with the intention always that we would continue as we got more comfortable and aware of how to basically show the membership that the research would actually be fruitful for them. Then we could work with smaller populations where we wouldn't need as big as a sample size, et cetera, in order to move it forward. So the partnership started, I don't recall the exact year, but I know it's been good 5 or 6 years ago. And we've been working together since 2016. So it's been a while.
So who were those two populations, or the groups that you begin to study? So how many reports did you do with USJE and your research? Can you elaborate a little bit more on that?
The first report we did was on parole officers working under Correctional Services Canada, so federal parole officers working in the community or in institutions. It was really interesting because in doing that work and looking at the literature, there's not a lot of countries that have parole officers in institutions, where we do in our federal system, which was, just an interesting, to talk about institutional parole and to differentiate it with its unique challenges and unique stressors, and talk about community parole and the space between. So we did that report, and it was a great study. We had 150 participants. We had French and English speaking from institutions across the country, and in the community across the country. And it was really, really insightful, and is probably one of the most significant parole studies that's occurred to date in Canada.
Well, that's very impressive. And that was led by the union who commissioned you to actually complete this research. And it was able to make some strong gains for the members of USJE who are parole officers. And I know because that created such momentum, USJE commissioned you to work on another group, I believe, who were employed by the RCMP. Is that correct?
Yeah, actually, we did both at the same time. They don't commission me directly. I'm leading the research, and I have a team. So we use the funds to pay for the research that's done and to support. And it was also really instrumental. And I think I can say with President Newfield is that we're also using that opportunity to create researchers of the future and to mentor people to study these populations, because there's a lot that are unrecognized. So at that time we did 2 populations at once. We always do 2 populations at once. So we also did the detachment service assistants for the Royal Canadian Mounted Police.
Now, just to be clear, although, you lead these researchers, I mean, your credibility here goes through like the entire ethics process. Can you just quickly touch on that very briefly?
I can, and tell me if I'm not being brief. We start kind of documenting sort of what our process is going to be. We go through the ethical review boards and ensure that we get everything's organized in terms of confidentiality, keeping people anonymous, what we can and can't do, how we can approach. Sometimes we'll also go through, like with the DSAs, we also sent that through our CMP's processes and got permissions as well. We didn't have to in CSC for the parole officer project. They approved it. And I believe the commissioner at the time, Ann Kelly, sent out the recruitment to the parole officers as well. Your ethics is your methodology. In some ways, it's the ethical portion of your methodology, but it really guides what you're doing. So we go through all the stages. And on the projects, we'd hired a postdoc, Dr. Mark Norman, and that was great. And we've worked together on actually all the USJE projects to date.
I think it's just good to mention that to our listeners so they don't just think it's a union commission report, it's union stamp. There's actually some, credibility in it. There's some ethics in it. So all these reports are very well respected because it's good data and there's, researchers behind this. So it's not just a union report that's been produced.
So in the example of the DSAs, if the RCMP had wanted the study, the report would have been the same.
Right.
It doesn't matter.
Wonderful.
It's when you do expert testimonies, if you do evidence, if you do science, the data's the data. You can't change what the data says. Data
is priceless. Now, keeping in that train of thought, right now, I believe you're working on a new research involving the legal assistants who are, again, USJE's members. So can you tell us about their work specifically and what you've learned so far? Because I know you're just beginning to work on that, so you can't give us too much detail, but just a tiny bit of a teaser on that front.
I think that the membership and the public needs more awareness of the amount of vicarious trauma, so trauma that you gain by being exposed to things, but not like indirectly, that individuals working in these positions are exposed to, their workloads, the materials they deal with, the lack of recognition in their jobs and for their role in public safety. It is laced with organizational and operational stressors that are very under-recognized. It was even difficult to do the literature review for this population because there's some research on paralegals, there's a little bit on lawyers, there's some on judges, but the legal assistants are almost absent.
Interesting. So we're talking about some traumas that people that deal with indirectly, but really have an impact on their mental health. So with these researches that you've conducted, what has surprised you the most about what members are sharing regarding the challenges that they confront on a day-to-day basis in order to keep Canadians safe?
So there's three things across the board, doesn't matter who I'm talking to, that seem to stand out. One, there's operational stressors, and these are inherent to the job. These will happen. You will be exposed to certain material in doing your job. You will, maybe some people have direct exposure to potential traumas or things that are traumatic, psychologically traumatic or physically traumatic, etc. In any of these positions, there are going to be difficult things. They're part of the job. And they're often people agree and accept this fact. And when they sign up for the job, they're aware that they're going to have to deal with some pretty heavy content at times. Doesn't matter what position they're in. But then there's the organizational stress. And that is everything from your coworkers, your colleagues, your management, your supervisors, the people that you're interacting with. In the case of parole officers, it might be the people under your supervision, right? For legal assistants, it's working with the paralegals, the lawyers, anything else that they're doing in that space. And it could be the shift work. There's so many organizational things, and they're all things that we can change. Well, operational stressors, you can't change them. Things are going to happen. They're going to not be good. The organizational stress, we can make organizational change and structural change that can remedy a lot of it. So I always find that flooring. And then the other thing it's deeply connected is, and this is my own recognizing my change in, I guess, how the evidence has moved my arguments. I always was under the impression that the trauma exposure was the real catalyst for what happens afterwards in terms of a person's wellness. But what I find across the board is that the trauma exposure can be, it can be cumulative events, it can be it can be a variety of different things, 100%. But if someone is supported well by colleagues and management after the event, and they're made to feel whole, and it's understood that, yes, that was difficult, and they're checked on, and they get debriefings, and they get supports, and they don't feel that they have to question their behaviors or that they did something wrong or feel that vulnerability, they seem to do better.
Okay, that's interesting. Yeah. I mean, the support is always key here. And I guess one thing that's being highlighted in these reports is a lot of members from the Union of Safety and Justice Employees don't have that support available to them. And one thing I find interesting that you mentioned is there's not a lot of research that's been conducted in this field in the last 20 years or so. So is it accurate that these conditions started to be diagnosed relatively recently? Because I don't remember talking about this about 20 years ago. So from your perspective, how has the field evolved in the last 20 years?
I think a lot has changed with recognition for operational stress injuries that came out of the armed forces. So the occupational stress injuries, and, we even have the post-traumatic stress injuries. We had the post-traumatic stress injuries bill, I think that was 2016, where we've actually drawn a lot more attention to not just symptom clusters that are diagnosable as a mental health disorder, but also symptom clusters that may not map on to a diagnosis, but are still debilitating. So there's been a lot more discussion, and, PTSD was shell shock back in the day, and it's evolved, and the DSM has changed its definition. We also see other things that aren't in the DSM that might be in the future, like moral injury. So there's a lot more discussion. There's a lot more research. There's a lot more talk about it. And we also have a changing culture where, and don't get me wrong, the stigma around mental health is very, very real.
It is.
We see it all the time.
Right.
But it might not be as bad as it was.
Right.
So there's incremental, teeny, tiny change.
Okay.
And a little bit of change is better than no change.
Right. So we're making small progress here.
I wouldn't call it progress.
No,
we're almost taking steps.
There we go. Now, do you feel there are unique challenges in dealing with injuries that are not as physically evident?
You can't see them.
Mm-hmm.
So it's really hard. You can't see when a person is ill, and you can't see when a person's better. We have symptoms. We have things we can look for. What I found very difficult is I'll have participants and people I know that death by suicide is very real in these fields. And I always find it shocking when a person seems to be doing better before they've decided to end their life. And that's really difficult. So how can something so difficult present so positively?
Right.
So mental health is a very interesting space. And also you have to remember, we're talking about public safety personnel. We're talking about individuals who are trained to be stoic, not show emotions, not react to emotions. And that is not training that is malicious in intention. You can't be working in a space where you're reading or you're transcribing difficult material and you're going to cry and be emotional. Like you have to be able to refrain and hold in your emotions and do your thing. So we also create this really difficult space for our public safety personnel where we teach them to suppress emotions, but now we're telling them to talk about it, but only talk about it in certain times and places.
Right.
And because you can't see mental illness the way you can see a broken leg, it's hard to know when it starts, hard to know when it ends. And then people also, they start to question it. And then we know stigma is real because people are questioning it. It becomes very challenging.
Well, it brings me to my last question. How has the medical field responded to our evolving understanding that these injuries, and what would you like to see change? I mean, you've studied this now for close to over 10, 20 years. So what would you like to see change?
So in terms of our healthcare system, I think the onus for mental health is placed on organizations, employers, unions, etc. When we look at our healthcare system, the mental health coverage is the psychiatrist, which is a huge wait list, doesn't matter where you are in the country. If you want, a psychologist, if you want to even talk to a social worker, any of these, it's your benefits or your own dime. And benefits tend to be capped. You have a mental health system that is very limited. And it's sort of like physical health is totally recognized in our healthcare system and treated immediately, where mental health isn't. And then we wonder why the stigma remains on mental health since it doesn't even have fruitful, fulsome treatment within our system. We're almost saying that it's less important and therefore we don't need to be managing it and working and we don't need it covered and we don't need, but there are changes. Like we have a mental health secretariat and mental health secretariats in provinces. We have a minister of mental health.
Right.
So we've made these changes. So there is progress happening, but I would like to see some of the onus for the wellness of the employees not to be placed on the employee and not to be placed on the employer or even be placed on the union. And also it be the responsibility of our healthcare system to keep people completely, wholesomely healthy. So those kind of changes, I think, are still a long ways away because everyone's concerned about what things are going to cost. But I think they need to happen if we're actually going to get rid of that stigma around mental health, be accepting of mental health, and to have immediate treatment. Because you can't show up in an emergency room with symptoms of depression and get instant.
Right.
Like it doesn't work.
No.
Right?
No. Well, thankfully, at least now we have some doctors like yourself on our side and we have some unions who can advocate on behalf of their members to try to, collect some data and advocate on their behalf with some credibility and hopefully advocate for some change. So Dr. Ricciardelli, thank you for being part of this podcast and thank you for working with USJE. And we'll see what we can continue to do together.
Thank you for having me. It was an absolute pleasure.
Merci. Thank you for joining me for this episode of the Union Safety Net, Le Filet de Sécurité Syndicale, a union podcast created by USJE for working people. If you have any feedback on today's episode or would like to suggest a topic you want us to cover, please reach out on social media platforms. We love to hear from our listeners. I'm your host, Sébastien Bezeau, and I hope you'll join us next month for another episode of the Union Safety Net, Le Filet de Sécurité Syndicale.